It has been a year since USAID was shut down by the Trump administration. Thousands of workers terminated, along with more than 5,300 agency-funded contracts, some of which helped fight deadly diseases around the world.
This morning, a WUSA 9 exclusive. In an investigative report supported by the Pulitzer Center, our Larry Miller traveled to southern Africa to have two main questions. What's happened since USAID was closed? And for countries that relied on USAID support, what do they have to get to secure U.S. support? Here's one part of the series, Aid Interrupted.
Finding tremendous waste, more than anything else, I think you could say. Probably fraud and abuse can be added to it.
It's really sad. An organization I care a lot about, that a number of my friends work with, and the cruelty is the point with this administration.
The closure of USAID came as a shock to the world and especially to NGOs, non-governmental organizations that depended on USAID funding. Starting in 2003, USAID and the CDC used taxpayer dollars to study, treat, and prevent HIV and AIDS around the world, and particularly on the continent of Africa. Well, when USAID was shut down last year, that left many people wondering what that meant for the future of global health.
It was a very traumatic year. We got a notice on a Sunday evening, I remember, that we had to close our services the next day.
Dowie Nell is the executive director for Out LGBT Wellbeing, an organization that provides HIV/AIDS healthcare services to high-risk groups in South Africa. He said his organization received roughly $2.5 million in PEPFAR funds administered by USAID, helping more than 1,600 patients get life-saving HIV medication. That funding vanished in an instant.
So overnight, we had to deal with a lot of stuff, like how to ensure ongoing treatment for this cohort of clients, and sort of internal issues in terms of your staffing, closing down.
In a 2025 post on X, Secretary of State Marco Rubio addressed the USAID contract cuts. He said the 5,200 canceled contracts spent tens of billions of dollars in ways that did not serve, and in some cases even harmed, the core national interests of the United States. On its website, the White House lists examples of USAID-funded programs it says were malicious pet projects of entrenched bureaucrats. They include $1.5 million to advance diversity, equity, and inclusion in Serbia's workplaces and business communities, and $70,000 for production of a DEI musical in Ireland. Former USAID officials point out that some of the items listed required context or were programs run by other agencies. NGOs in South Africa say their health programs were anything but wasteful.
It is a bleak picture following the closure of USAID.
Since the funding cut, Nell said some of the more than 1,600 clients he was treating are now missing.
At this point of the game, we know 200 are totally lost. We can't get hold of them.
Health experts say patients diagnosed with HIV and AIDS require routine visits to check medication adherence and more. If patients fail to take their medication regularly, the virus could rebound and potentially contribute to new infections.
I thought that this is the end for us, especially for those who are positive.
One of Nell's clients, who we'll call Brian, has seen the drop-off in clients returning to the clinic since the funding cut.
They told me, what is the use of going there, because there are no longer fundings. Yeah, I did tell you, there are no longer fundings. That doesn't mean there's no longer medication.
In late 2025, some of the countries who received PEPFAR funds began announcing new memorandums of understanding, or MOUs, with the U.S. State Department. These new, multi-year agreements provided PEPFAR funds, but required countries to commit to specimen collection, data sharing, and access to sensitive information. Some countries, like Zambia, allege the U.S. State Department demanded mineral rights in exchange for funding. Rare earth minerals like cobalt, lithium, and copper are vital to U.S. companies looking to produce new AI-powered technology. Many of the minerals needed to do that at scale are present throughout various countries on the continent of Africa. In a statement, Zambia's foreign affairs minister called the proposed provision unacceptable, adding Zambia must have a say in how her critical minerals are used. We asked the State Department about the alleged mineral rights provisions. A spokesperson for the agency said there are not critical mineral provisions in any of the America First Global Health MOUs and no plans to sunset PEPFAR, We have prioritized continuity of care through bridge funding for PEPFAR and remain committed to responsible stewardship of the program. But while Zambia rejected its proposed MOU, South Africa hasn't made much progress in its talks with the U.S. PEPFAR funds administered by USAID funneled more than $200 million into its HIV/AIDS response, although our bridge program provided $115 million after USAID contracts were canceled. That deal expired last month. And sources tell me PEPFAR funds for some NGOs are now on a month-to-month basis for now. The uncertainty is contributing to its own problems. Dr. Linda Gale Becker is a leading HIV scientist and clinician. She's also the CEO of the Desmond Tutu Health Foundation.
It was only 1/5 of our program, but that 1/5 was providing counselors in the clinics, tracers to find people who had disengaged with treatment. The Western Cape, when I am now trying to implement the lenacapavir rollout, we don't have counselors in the clinic who would do choice counseling, for instance, who are doing the HIV testing.
Larry Miller, WUSA 9.